Is we're going to bring up Dr. Daniel Royal. Come on up.
So I would much rather just talk about patient cases. To me, that's much more interesting, more exciting than some of the boring stuff I'm going to talk to you about now. We had a patient come in today, for example, that was umbilical stem cell cords. And so like Julie says, they come in, we work them up, and we want to make sure that we give them a comprehensive treatment. I'm a big believer in synergy. So I'm not a believer in the magic bullet. I don't believe that just giving umbilical stem cell cords or whatever else you're using is going to cure everything that ails the patient. So we want to look at their blood work. We want to know what drugs they're taking. And that was the case with this patient today. And looking at her previous blood work that she had, I could tell what you're taking is not working. So for example, one of the medications she was getting was bioidentical hormones. You can take a look at the blood work and say, I know you're getting it from compound pharmacy X, whatever they're doing is not working, so we need to do some additional tests and maybe change your regimen in addition to everything else that we're doing. Now, one of the things that Julie mentioned in her presentation is we filed a patent, it's maybe about 5 years ago or so. It's actually still pending an appeal. It's very hard to get a patent for a process. So we created a process in conjunction with someone who's been in the adult stem cell industry. That doesn't sound very good. Adult stem cell industry for about 20 years doing research, and so his resume was about as long as the lab director over here. But he had discovered a way to get pluripotent, you call them multipotent, but it's the same thing, pluripotent stem cells into the blood, which they're not normally found. They're in all the tissues of your body, and to be able to count them. And what we did in coming together is to find a way to make that practical, to put it into a clinical application. So our process is actually, when you're doing autologous cells, and this is what we're going to talk about now, but when we do autologous cells, our process doesn't take 2 hours, it takes more like 3 days, to do, and some prep work. So what Julie is talking about, it really is a turnkey model, so the patient can come in, we do the evaluation, we do the treatment, and she's very happy. So all the patients we've treated so far using umbilical cord stem cells have done very well. They have really zero side effects. She talked about the one patient that had some flushing, but when it was happening, he said, I feel fine. And he already had like some dermatological condition for which he took an antihistamine. But generally speaking, I've been doing autologous stem cells for almost 7 years, and we've had no reactions, no bad reactions, I should say, to patients that are receiving their own stem cells. And that's going to tend to be the case when you're using pluripotent stem cells like umbilical cord stem cells, because they're fairly ubiquitous. It can be used by everybody. You notice when you're using these types of cells, you're not having to match their blood type. So that's an indication how safe they are. The fact that she's gone all the trouble to get malpractice for stem cell therapy, I'm sure there's a lot of doctors out there who think they need it, but the reality is it's incredibly safe. And there's many ways to protect yourself, but we're not going to go into all that today. So the one initial that I left off there is JD. So I'm also an attorney, and actually when I was in law school, when we graduated, I was one of 2 people that already passed the patent bar. So I'm actually a patent attorney. So that was always an interest of mine. And so I'm currently the only DO who's licensed to practice law in the state of Nevada. So that's something that makes me unique. But basically, in doing law, I do a lot of my own legal work and contracts and so forth. But mostly I do volunteer work for the state bar, which means that I sit on the disciplinary committees. So when the lawyers get disciplined, I'm there to help make their life easier. Because anyway, it's a long story, but I enjoy that. So we're going to see. These are just some slides we're going to go through fairly quickly, because I don't want to bore you with a lot of technical information, but we'll talk about some things that you won't hear anywhere else that were shared with me. I'm going to share with you. That was created by a friend of mine, and we got a little commercial we'll show you a little later that we created. So you can't see this very well in that white background, but this is just an introductory slide, and I know you see the fetus there, but we're not talking about embryonic stem cells. We're going to be talking about pluripotent stem cells. They could be autologous, they could be allogeneic, which is what umbilical cord stem cells are. Allogeneic, meaning that they're from a source other than your body. So there's different types of stem cells, That's what the SC means when you look at those. But it all goes, they go up a chain. So the PSCs are the pluripotent stem cells. Then there's one called totipotent stem cells. And there is a way of measuring these stem cells in the lab. It's very difficult to do, but there are some labs out there that have the capability now. It's becoming more common. So the researcher that I worked with, when he was measuring them, he used hemocytometry, which means that he was doing staining and manual counting. And then we paid a lab to, actually LabCorp, we work with the research department to develop a test to analyze the cells that we were getting, in this case, from the blood. And so when you're analyzing these cells, you're looking at certain types of CD markers. CD10, you're probably familiar with them, CD90, CD66E. And so the totipotent cells would be the very small ones. So when you read the literature, there are patents out there, for example, and trademarks, using the term blastomer-like stem cells. So they go by another name, BLSCs. And then you've got the pluripotent cells. Those would be the larger ones, maybe the ELSCs, which is embryonic-like stem cells. So they come with different markers because of their sizes. We don't know if they have different functions. And then there's a transitional cell. Anyway, they break down to the different germ cell layers. And so when you are drawing blood from the bone marrow, which I've done in my office, by the way, I used to have the harvest machine and we did some bone marrows. They don't have to be painful, okay, if it's done right. And they do the PRP. When you're doing blood draw from the bone marrow or you are liposuctioning for the fat, those are what people call mesenchymal stem cells. Although technically they're not stem cells, because a true stem cell will divide forever until it decides what it wants to be when it grows up and starts differentiating. So when you're using those mesenchymal cells, which are in the middle, they're technically only good for certain conditions, which would be cardiovascular and orthopedic. So if I've had patients that were told they can go down to Costa Rica, they're going to liposuction their fat and charge them $50,000 to treat their lungs, by the way. And so there may be some other cells in there that are not mesenchymal that may potentially help them, but that's not what they're advertising. And same thing in Mexico. You can go down there and get liposuction for stem cells for $30,000 to treat your MS. The reality is those cells are not indicating for neurological conditions which come from the ectodermal cells. And then you've got endodermal cells, which are for the organs. And so we're going to be using stem cells. It's very important, legally speaking, that we use the right terminology. So for example, if you're going to do marketing and you have a website, make sure that your terminology is concise and correct. Because the FDA, they scour the internet, they're looking for people who are doing quote-unquote stem cell research, or even stem cells if they're not stem cells. Be very careful how you market yourself. There are lawsuits being filed against some stem cell clinics, like the lung stem cell clinic down there in Florida, which are using a type of, I think they're using bone marrow to treat lung conditions, so the mesenchymal cells, and technically that's not what they're indicating for, so they've got some problems. This is just breaks it down again. This is very similar to the slide you just saw, but what it does show on there is that the cells that we're looking at from the previous slide, the size, 0.2 microliters to 8 millimeters. I think that's supposed to be microliters. So that terminology is not correct. But they're very, very small. This is why people over the years, when they looked at it under the microscope, they didn't realize what they were looking at. Partially because they're not always there, also partially because they just thought, well, that's just artifact. They didn't realize what they were seeing. And that's also why they're very hard to measure in the lab. One of the things that's important to understand about stem cells, as I mentioned earlier, they tend to divide forever until they start differentiating. When they start differentiating, then the biological clock starts ticking. And so theoretically, that means they're going to have a doubling time of 50 to 70 before they die. But in other words, once they start differentiating, there will ultimately be cell death. And so those are the precursor cells. When we talk about precursor cells, that's mesenchymal cells. The stem cells have already headed in a direction. They've already started differentiating to become something. This is just a 3D. You can't see everything because of I don't know, for whatever reason, the background got on here, but it's showing that this is the blastomere. It's the stage by which the embryo is developed. And the really small cells, let's see if it shows up on here. That doesn't show up either. The really small ones would be the totipotent cells, the BLSCs I mentioned earlier. The medium-sized cells would be the pluripotent cells, the ELSCs. But they're all part and parcel of this embryo that's in formation. This is just another, now we're going to look at some slides that have different staining for these types of cells. They're just different ways of looking at them. Again, you see, oh no, it doesn't show up on here.
Boogers.
Okay, so the top one is ELSC, embryonic-like stem cell. Okay, that one, the size is, as you can see, 6 to 8 microliters. Then you have the smaller one, the totipotent, or the BLSC, is blastomer-like stem cell. Those are 0.2 to 2 microliters. And then the one in the middle, that looks like a whale, that's the progenitor cell. Okay, so that's one that's already started dividing and becoming something. This is also looking at the tissue with different types of staining. These two cells, some pick up one cell, type of stain, some another, and so you'll see these abbreviations for the type of stains that they're using. And again, just comparing the different sizes between these two types of stem cells. This is actually looking in the blood now. Again, the CD10, CD90, or the BLSCs, ELSCs, with the two different types of stains. There's another type of cell in here. You see the TRBLSC. That's the transitional cell, or this, what we call CD66E. So that's the transition between the small and the large. And interestingly, the researcher that I worked with, who actually teaches embryology in the medical schools, he feels that that's the cell that has the most biological activity, although none of that has been proven. We really aren't even sure exactly what these other cells do, I mean, specific to those particular cells. So there's a lot of work that needs to be done in stem cells, not just clinically, but in the research as well. Now we're just looking at a couple different tissues. This one happens to be the pancreas. It's showing, you know, what happens after they've been exposed to certain types of media and where the stem cells are involved. And it's hard to see here, even though there's different the magnification is the same here, but you can see that they're growing from the left side to the right side. And the stem cells tend to be attracted. They tend to be attracted to areas that are damaged or in need of repair, as a general rule. This one is looking at lung tissue. Now we're looking at different magnifications, a couple of different types of stains, but again, showing that the stem cells are attracted to areas. These are actually tissues taken from rats that have been damaged. And so then they expose them to growth media, and then they measure or stain the stem cells to show where they're going. In this case, they're going to the ducts, the alveoli, the bronchioles. Here we're looking at blood again. I think this is the blood of horses, just showing the different sizes and staining. Now we get to the more kind of interesting part. The question is, what do we do to increase cells in our circulating blood? Because they're not normally there. Now, if you break your leg, the body will flood the circulation with stem cells, because as I said earlier, they're in all the tissues of your body. But there are some ways to get stem cells into the circulation without having to break your leg. And so one way is to use blue-green algae. So one of the things that the researcher discovered, and for which he had an IRB where he was working, was by taking this product, this blue-green algae, he was able to increase the amount of circulating stem cells in horses, they looked at first, and then in humans. And there are other products, other modalities that may work as well. So for example, I had one patient who couldn't swallow capsules, so we would expose her to a pulsing electromagnetic field. And when we went to draw her blood later, her stem cell count was as good as if she had been taking the blue-green algae. So we know that a pulsing electromagnetic field works as well. And then the only reason I'm telling you this is these are things we might be able to use to enhance what we're doing. Remember, I talked about synergy. I'm a believer in combining things. And the reason I say that is some of you may be familiar with a product out there called Protandim. Protandim is an interesting product because it has, well, first of all, it has some patents on it, which is unusual for a supplement. But the thing about Protandim is the researcher found that the products they put in there, the adaptogens, which are, let's say there's 40 adaptogens and there's 4,000 antioxidants. The adaptogens all increased antioxidant activity in the human, but when he made certain combinations, he found that they increased almost logarithmically. So there was synergistic effect by combining them. And so we may be able to find that in working with umbilical cord stem cells. And so this is just a product we have made for us. It includes primarily the blue-green algae, but a few other things. This product is actually used around the world in horses and race horses, and helping them to recover quicker from their exertion, to heal faster from their wounds. And interestingly, the trainers find that the horses are more docile when they're taking the product. And I'll show you another example of that in a minute. Now this product has also been tested in other animals. This is actually in dogs. And so what it's showing is over a period of 4 weeks, gradually increasing their circulating stem cells. So that, in this case, typically what we do to make that happen is we give them instructions where they're gradually ramping up the amount of blue-green algae that they are ingesting. In this case, it was being put into doggy treats that were made specially for them, and then the blood was measured periodically. This is showing, again, this is over a long period of time. Instead of 4 weeks, now we're looking at about 3 months. I think this was in horses, in measuring it. Again, they're taking the product. I think in the case of the horses, in this case, they might have been taking it the same, for a period of 3 months. But you can see there's a gradual increase. This is actually in humans. It looks very similar to dogs. These were some studies that were done on human subjects in China. Again, same kind of protocol the dogs were. The first week, maybe they're taking 1 capsule a day. Second week, 2, 3, and 4. And then these were some tests that were run in the dogs. So this is just a safety study that showed, yes, they were taking this product, they were increasing their circulating stem cells, but nothing was found wrong with any of their lab parameters that were measured, the chemistry. That was over 7 weeks. Now, this is an interesting evaluation that's done in dogs. So those of you in the medical profession, you're familiar with the APGAR. In the dogs, they have something called APBAR. Anybody know what that means, APBAR? So now you're kind of looking at the mental health and well-being of the dog. So let's see, the APBAR stands for alertness, and then the P is performance, the B is behavior, and A is attitude. Oh, very good. And R is responsiveness. So you can see none of those are physical attributes. That's mental well-being of the dog. So this is their evaluation, okay, pre-exposure to the product, and then post-exposure using the same measurement tools. But what's happening is, again, their circulating stem cells are increasing. So it's affecting not only their physical health, but their mental health, and with no pathology. So now we're looking at mice. I know it may look bad because it talks about lesion site, inflammation, necrosis. This is in comparison. This is actually compared to controls, how much better they did than controls. In all these areas, those mice that were exposed to the product that increased their circulating stem cells as opposed to those who didn't. This is an interesting study. It's actually done in worms. This is a worm that's used because it has a relatively short half-life. But the interesting thing to note in this is by exposing these worms to the media that had been exposed to the product, they lived longer. So they lived a little bit longer. What does that allow us to say? Stem cells can be used for anti-aging. So that's one extrapolation that can be made for this. It helped the worm live a little longer. This is also kind of fascinating because now we're looking at a couple of different types of cancer cell lines. And the cancer cell lines that were exposed to the stem cell product, it actually had an inhibitory effect on these different cancers. We're looking at the stomach, lung, colon, and prostate. And this is interesting because I've had a couple of patients who come to me, they had stage 4 breast cancer. They were treated by a doctor up north. And once they're in remission, he sent them down to me to treat them with stem cells. Studies have shown that patients, in this case, stage 4 breast cancer patients that have had stem cell therapy have a better remission, recovery, longer life, etc. So we're going to hear more about that in the future. That's something that's we're starting to incorporate more into our armamentarium. This is just another one of the cancer cell lines, but again, showing that it had an inhibitory effect on them. That's percent of inhibition. And then now, Lori talked earlier about the different ways and means by which good stem cells, this is one of them. So that's a duplicatory slide. There's the bone marrow. I was taught, actually in my office by an oncologist here in town, how to do a bone marrow in a way that's relatively painless. Even my mom came in and let me do the bone marrow. So it can be done. The problem is it's a lot riskier than just doing a blood draw like I do in my office, or do an IV push like with the umbilical cord stem cells. And as doctors, again, our mantra is first do no harm. So why do we need to take the risk of doing the bone marrow or a fat? And there have been some problems. I mean, people have had some bad outcomes from those procedures in and of themselves. So if we can eliminate that but give the benefit, why not do it? This is just giving you an idea of something that could be done. Let's say you wanted to do a study in your office. This is something very simple that can be done. In fact, I did do it with some of my patients just for the fun of it. And what this is, any of you familiar with heart rate variability? Heart rate variability. There's different algorithms. I worked with the Israelis about 20 years ago. They had their own algorithm for doing heart rate variability, and we did a very interesting study showing that by taking homeopathic remedies, you can affect your heart rate variability. What is heart rate variability? It's a way by which you can measure your autonomic nervous system, your balance of sympathetic and parasympathetic tone. The Russians also have a very good algorithm, and they actually have a company here in the United States, and it's a very good job, and it's well supported, and you can buy the software and use it in your office. It takes, maybe you can do this in like 5 minutes and get this information on your patients. So you could do something as simple as doing a fitness test prior to giving the umbilical stem cell cords, and then do the treatment, have them back in a month, and compare. So this is what it looks like. So if you're doing something simple like this, it gives you a fitness test. What you're looking at there is, if you look, they just have a way of measuring it. So the horizontal line is wellness, the vertical line is adaptability, and then they give you a score. And then they can break this down into a graph where now you're looking at the balance between your parasympathetic and your sympathetic. I know if you haven't seen this, it's like, it's like Greek to you. But it is a way for you to measure whatever you're doing with your patients, whether you're giving medications, you're giving nutrition, or homeopathics, adjustments, stem cells, whatever it is. It is a measurement tool that we can use for any of these things. This is the fitness test again, but it also gives us specific numbers and a pattern. And actually, we worked with the Israelis. One of the main things we were looking at was primarily just the pattern. And this is just another way by which we get stem cells. You can get them from the blood, although we're not going to be doing that with umbilical cord stem cells. But it's very possible that by taking it in conjunction with the product, like I mentioned, we may have a synergistic effect. And this is just showing that the stem cells, they can be measured in the lab. We had a lab that took our stem cells and grew them over a period of 3 weeks. And even after 3 weeks, they were 97% viable, still growing, still multiplying. And they're the exact cells that we were interested in obtaining for our patients, the CD10, CD90, CD66E. Now, when we give back the stem cells, the umbilical cord stem cells, typically we do the IV push. It's very easy, and as Lori said, it takes a very short period of time. I mean, you use a small IV. Some people do IV push. I tend to do an IV drip and then give IV push as part of it. But one of the things that we typically do when we do that with the umbilical cord stem cells, we dilute it a little bit. And the recommended dilution is about 5 to 1. So 5 cc's of normal saline with a cc of umbilical cord stem cells. And the patient that did have the flushing, he's the one patient I didn't dilute it enough. So I don't know if that was a factor or not. This just shows the different ways and means by which we can get back the stem cells into the joints. And so the knees is an easy joint to get to, but one joint that's often forgotten is the kneecap. So depending on where the problem is, they may not need injection just in the knee, but they may need it beneath the patella as well. And I've had some interesting experiences working on patients. Actually, we've done it with all these conditions. Patients with shoulder pain, neck pain, hip pain, you name it. We've treated all of it with stem cells, and they've all had good results. One of the things I found most interesting about stem cells is it's very good for eliminating pain. So even the patients we did umbilical cord stem cells, within the next day or two, their pain was gone. And I don't tell people to expect a miracle. It'll happen today. My experience is it can take up to a few weeks. So even the patient who lost her brain fog, that took a week.
A little over a week. Yeah.
A little over a week. My longest patient was a rheumatoid arthritis patient. She was actually wheelchair bound. She had one joint that gave her a problem, and that was her ankle. So we treated her. We gave her some IV, and then we injected the ankle. But it took 5 weeks. After 5 weeks, all the pain was gone, and that was over 3 years ago. So, but typically, when you're injecting like a joint, you're using a proliferant solution. We call that prolotherapy. Typically, it takes about 6 weeks for the healing process to play out. This is just showing another way that we can access the brain. We can do it intranasal. There are medications being developed today for that very purpose, to be given intranasal to get into the brain quicker, so that you can have a response within a week or less as opposed to 3 weeks. So for example, the patient in the office today, we had her lie on the exam table. In this case, usually I like to use a massage table. Depends on what's available. We have them put their head down. I'll show you another position. Sometimes you put them in Trendelenburg, but that's really, the head is not down far enough. The head needs to be down because I don't want to go down the back of their throat. It needs to go to penetrate. So when you put the stem cells in there, they're actually small enough they can't penetrate on their own. So when we first started doing this, we just did the nasal implant by itself. Then we got a little smarter, add just a little bit of DMSO. The reason I like to use DMSO is because it does help it to penetrate, so it will go through the cribriform plate, into the arachnoid space, the meninges, and into the brain. But it also helps the stem cells to differentiate, and that's something we've seen in vitro studies. This is just a slide to say, hey, we have never had a problem with stem cells. I don't know if you really need to in malpractice insurance, but doctors, there's a lot of doctors out there who've never even given an IV, much less an IV push or anything like that. So they're probably going to need it more than those of us who are already actively engaged in alternative medicine. This just shows you don't have to be sick, to use stem cells. We can use stem cells for anti-aging, and I do have patients who come to me, for that as well. I'm a relatively healthy person. I didn't necessarily need stem cells, but I have a rotoscoliosis that happened since I was a teenager, so it always gave me discomfort. And so over the years, I tried a lot of things. I tried pillow therapy. I tried yoga stretching. When it would stiffen up, I would do exercise. Then I did the stem cells, and the stem cells caused the pain to shift. So it would, at this point, earlier in my life, it was the middle back. Then it went to the lower back. The stem cells caused it to shift laterally, and I did a second treatment, and it's gone. And that was over a couple of years ago. So it's nice. I exercise now because I want to, not because my back is stiff and in discomfort.
Have you measured the scoliosis? Do you know what you were starting with? What degree?
I don't measure it, and the patients aren't going to care either. If they're pain free, they're going to be thrilled.
I'm just wondering.
I just figured at my age, it's going to be with me, but I don't notice it. Yeah. And so but the thing that people care about is the pain, because you're aware of that all the time, and it's sometimes it can be debilitating or it can just be annoying.
Egg and sperm unite, and a single powerful stem cell is created. From that single stem cell dividing billions of times, a baby is born. Replicating stem cells create your heart, your organs, your entire body. Stem cells, the basis of human life. Then they just disappear? No, stem cells exist in your blood, circulating and repairing your body during your entire lifetime. But stem cells need close proximity to injured or diseased areas to help enable healing. A new, patent-pending medical procedure harvests and concentrates your own natural blood stem cells. Concentrated stem cells are then injected directly into your diseased or injured knees, joints, hips, or back. If a single stem cell can create your entire body, what can millions of concentrated stem cells do to help repair areas of your body that need repair? If you suffer constantly from knee, joint, or chronic back pain, luck is not on your side. Can stem cells change your luck? Call 702-444-LUCK and find out. That's Royal Medical Group at 444-LUCK. 702-444-LUCK.